Hi.
How are you?
Can you hear me?
Yeah, can you hear me?
Awesome. Yeah, I can hear you now. I'm so happy to have you on and talk now to
I
get things
know, it's been so
rolling.
long.
I know. I wrote out some things for us to kind of guide us along because I
Okay.
kind of figured this can be the start of stuff. Because I
Yeah.
know you've been working on your outline and everything else, but I was
Yeah.
like I said, using the educational nurse, I already started. I've been trying to brand everything of what they've been
Yeah.
saying. So I just figured, on YouTube, having this
Mhm.
conversation, it's the start of something for both of us
Yeah,
in getting
absolutely.
ourselves out there. So it's just the first start is sharing a little bit about our backgrounds, what led us to choose the nursing careers that we're in now. So I just figured that we can kind of go back and forth a little bit about our
Yeah.
journeys and
Yeah.
so we know where we are today, because the good thing is, or the beautiful thing is, that we both have our masters, and it's
Mhm.
we both
I'm
sit
working on
here
mine, but yeah.
and have different career paths kind of
Yeah.
thing, because I been taking a different look, because so with the endometriosis, I am out of work. I've been out of work since November.
Yeah, that's rough.
It's crazy because I started having pain. So then I went to my doctor and I had the surgery, and then found out that I had the endometriosis, which makes sense because years worth of not being able to get pregnant, having,
Mhm.
all of it and stuff. So anyways, so we'll start with basics. So tell me about your nursing background.
So I actually didn't realize I wanted to be a nurse. It was always in the back of my mind because my grandmother was a nurse. But I went to college planning to study political science and become a lawyer. And I was
Ah,
very set on that. I was like, I'm not going to change my major. I remember learning at, orientation, this many percentage changed their major. I was like, oh, it's definitely not going to be me. And
yeah.
sure enough, during sophomore year, I was like, I cannot sit through one more second of political science. I want to be a nurse. I have to be a nurse. I know this is what I'm supposed to do. It was actually a nurse at Dana-Farber in Boston that had inspired me and made me make the jump.
Yeah.
Um, so I ended up doing the second degree program at MCP and I got my BSN there. And then early on, I was at Milford with you.
Yes.
And I started as a night shift oncology nurse. That was really hard. I became a float nurse and I loved going to the cardiac floor and the other tele PCU. So as soon as a job opened up, I went there and I stayed there for I think like 6 years. And
Yeah.
then I don't know if I shared this with you, but when I was in the years of trying to get pregnant, not knowing I had endometriosis, I actually got strangled by a patient on NP1.
What?
And yeah,
Wow.
um,
That's kind I have kind of a similar story. It was my stethoscope. That's why I tell my students, don't wear it around your neck. One, the oils on your skin degrade it, but it
yeah.
literally had a patient push me up and grabbed it, and I was like, whoa, it was a
Oh,
dementia patient. So it's
yeah.
you can't really say they
I
meant to
know
do
it's so
something, but just
hard.
being in that situation. But tell me
Yeah.
more about it.
So this guy was completely alert and oriented. I will never forget it because it was the day before Valentine's Day, and I asked him, I had a student that day who was doing everything by the book. And I was like, can you tell me your name? Can you tell me your date of birth? Can you tell me where we are? What's the day? And I remember like yesterday, he goes, it's the day before fucking Valentine's Day. So he was learn oriented for sure. Very aggressive, very rude, very non-compliant. He was on the PCU. He had a Foley. He, had all the leads on for the PCU. He had oxygen. He was hooked up to a Lasix strip, an antibiotic. Basically, he was so non-compliant. He had stopped his Lasix, developed raging cellulitis because his legs became so edematous that the skin
Mhm.
cracked. And he was also a diabetic, so perfect opportunity there. And towards the end of the shift, after basically being verbally abused all shift, Um, he set off his bed alarm and I went running in and I was like, I need you to sit down. And I was careful to keep my distance, but apparently I'm not careful enough because this like 400-pound man lunged at me and got me by the neck. And thank God my student was there. She screamed so loud that it scared him and made everyone running. Because I mean, it's 3 to 11, almost change a shift. So
Yeah.
not too many people around. But he got so stunned, I was able to tuck out of the strangle. And as I did, his hands grabbed my face and he got me by the glasses. And he bruised the bridge of my nose, ripping them off, broke my glasses, and then cut right here with his dirty fingernails. So
Uh,
after years of trying to get pregnant, once I finally did that October, I started having really bad PTSD going into work because I think I was in denial about the fact that this man basically tried to kill me. And
mhm.
now I'm finally, after years pregnant, like, and going through IVF to get there, I was like, I can't work here anymore. And so I left and took a job in case management that I hated, but I still love
Mhm.
I met some great patients along the way. I worked with great people. It just wasn't enough for me. I think going from a PCU to case management.
Oh, it's a hard. That's kind of where the boat I personally feel like I'm in because I'm out of work, as I said, and I'm having PTSD about going back to the
Yeah.
bedside because what kind of happened to me is the guy I had, he was 300 and something pounds or
Mhm.
200, literally dead in the chair, and the bed was behind me. So this is back in 2020 where I literally had to pick him up and do this quick twist and throw him in the bed to be able to do CPR. There was other people there, but he was diaphoretic. He slipped out of my hands. So then everything happened. I walked down the hall to go take care of a patient on PCU, and I bent over to flush a G tube. And when I stood up, pain went right down my leg, and I almost fell to
Mhm.
the ground. So long story short, that's when I found out that I herniated my lower back. L4-5 on the right, L5-S1 on the left with nerve impingement. Was out of
Mhm.
work for a while, PT the whole thing, but I had the PT about going back to work. So
Yeah.
then here I am again, kind of going through the same thing. And like I said, I
Yeah.
had the surgery of January of 2023, finding all that
Yeah.
stuff out. And I started having swallowing issues, all the stuff. And then it kind of led up to having migraines and all this. And the pain in my lower back got worse. I started having pain in my neck. And then I ended up in the hospital admitted, and I've been out kind of since. And come to
Yeah.
find out, I have 3 herniations in my neck. And they say going through PT, it is from me compensating for my lower back. So I
Mhm.
know exactly how you feel about the PTSD going back into the bedside and
Yeah.
just being so fearful of what
Yeah.
may happen because right now everything is so unpredictable.
It
That's
is.
why I
And like,
kinda turned around and said, "My career, I need to do something different." And I said, I went for my master's. I don't know if you have the same thought process of, I did it for a 5 to 10-year plan that if I ever went for a job, I don't want someone to tell me no. Because
yeah.
all the nurses we have right now and where I teach, we teach. So I teach at MCPHS. I
Yeah.
do the 16-week program, and I love it, and I love teaching
Mhm.
at the bedside, but being the person actually working at the bedside is so tough.
Yeah, it really is. So after, so I worked for case management until I had my son. And then the thought of going back to work Monday through Friday full time in a job I didn't like and leaving this little baby that I waited so long for, I was like, I can't do it. So I worked per diem in urgent care where I had been working per diem for a year. So I felt very comfortable going back and it was very per diem. Um,
Mhm.
and then a job opened up in outpatient cardiology, and I'd always loved cardiology. It was one of my favorite things about floating to Gannett. So I was like, you know what? I was gonna work per diem for a year until he was a little older and I felt more comfortable doing daycare. But this opportunity has come up. It's part-time. I feel like it's meant to be. I'm just gonna apply and see what happens. And I got the job, and it's it's good in a sense because it combines, and I do still miss the bedside, but it combines a lot of that knowledge and critical thinking that we learned in the hospital with some hands-on care. So it was a really good in between for me. And then
Mhm.
like a month later, COVID happened. Um,
Mhm.
but I started to have a lot of guilt about not being there with all of you guys at the hospital. I mean, I was inside a hospital, but in the outpatient area. So um, after a little bit of time, I felt like, I'm in a better place mentally. I think I can go back and not panic. And I did. I went back for about 2 years until we were in the thick of it again with IVF. But at that point, I had applied to nurse NP school. So I was taking two challenging classes. I had just had two failed IVF treatments, and I was working per diem and outpatient cards and per diem at the hospital and trying to be a mom and a wife and a friend and all that. And I was like, I'm going to lose it. So it was really hard to, but I ended up resigning from the hospital. And at this point, I'm working per diem at cardiology and chipping away at school, taking it slowly, knowing that it's not a race to finish. And um, I feel like the driving point for me for going back for my master's was that I know the bedside isn't forever. Even if I go back and do another year or 2 years, whatever, like it's not a long-term thing. Yes, there are some nurses that do it forever. They're the unicorns. I don't know how they do it.
I don't
So,
either. I don't either, but
and I
yes.
don't think I have a desire to, honestly, like as much as I miss it often, I
Hmm.
don't have this urge to go back like I did the last time.
Right.
Um,
It's like we have to finally, I guess, solidify to say this is like I got my basics. I always feel like, and I try to tell nurses that your basics is working the bedside,
yeah,
learning that nursing intuition that you kind of grow, that you
yeah,
turn around and you're like, something's not right here. What is it? And then all of a sudden someone's calling a code or something happens or someone needs help. And it's like
yeah,
that urge you have. But then, yes, you graduate to a certain level to say, like, I don't want to do this forever because I realize my body, if I mind, can't handle it.
yeah, yeah.
Because it's
It's a
amazing of what we
lot.
see. Because I always tell everybody, the students, I go, our job is the most beautiful thing because we get to see the beginning of life and the
Mhm.
whole process of getting there, like we talk about. And then sadly, or the most beautiful part is the end of life. Like people look at
Yeah.
it, like I'm a big promoter of death with dignity and
Yes.
giving people those chances to make choices for
Yeah.
themselves. Because us nurses, the doctor comes in and gives all these mumbo jumbo words, and then the patient's
Mhm.
sitting there with this face like, did he just tell me I
What?
have cancer? Did he
Yeah.
just tell me I have kidney failure and I need new kidneys? Like that
Yeah.
whole combined, but it's like we start growing that knowledge and then saying,
Yeah.
how else can we help the world bigger? Because right now,
Yeah.
we only deal with one person at a time when we
Yeah.
do our job. Yes, we have a whole caseload of 4 or 5 patients, whatever it is, but you can only touch those people so much. And
Yeah.
then the one thing that I loved in the beginning about bedside nursing is that I go there, I do my job, and then I stop. I go home. I don't bring it
Yep.
home with me.
Yeah,
And
we
then it's like you
physically
think
can't work
about
at
these
home.
people all the time. And then you have your own life
Yep.
experiences and you turn around and saying, I need to share what I know with the world. And that's
Yeah.
one of the reasons why I feel like we're starting this whole thing. And with like educational nurse, like I just pictured because my career is I always known I wanted to be a nurse. It was
Mhm.
funny that what started is that I always helped everybody else and I was always the one there. But I going through school, I felt like I wasn't smart enough because I was that
Mhm.
average student. Like I think it would be A, I think it would be B, and it was just going through school. And then when I got into like going to college, I worked during the day and went to school at night. And then I passed, the biology, the chemistry, the prereqs, and then I'm like, maybe I can do it. And
Yeah.
then I got into the program. I actually got my associates from Mass Bay, which is a
Yeah.
small community hospital college, and
Mhm.
then worked the bedside. And then I worked for a little bit. And what got me to kind of go into teaching the legal nursing and everything I do is I was a nurse, I was working nights, as we said, and I was on the beach at a small pond and I hear this horrific scream and
Yeah.
I like look up and I see this mother pulling her young son out of the water, like with everything she had, and screaming for help. And I looked over at my sister's friend. I said, call 911. You jump into action, did what we need to do. He was 11. We got him back, but sadly, 5 days later, he died at the hospital. I went about my nursing, always thinking about him. But then it's like I get a letter in the mail saying I'm being subpoenaed for a deposition because I was involved. And it scared the crap out of me going, I know I'm covered on the Good Samaritan Act, but wait, what? I'm a new nurse. I'm so afraid. So then
Mhm.
that's how I started getting into the legal nursing because I looked
Yeah.
up all of it. Legal nursing is new. It's actually only really been around since the 1980s, actually 1982, because a
Mhm.
lot of lawyers were working with physicians. But then the pushback is you're not a nurse. You don't know what we do at the bedside. Because it's
Yeah.
amazing when you actually step back and look what doctors do and what we do, total two different things. And
Yeah.
we're the ones sitting there more educating the patients about what's going on. And then my
Exactly.
year's worth of teaching, I'm like, if you can't say something in simple terms for someone to understand, you don't get it yourself. Because the doctors sit there
Exactly.
and give out mumbo jumbo. And I realized the grade level for today's society, we have to teach at a third grade level. Like you can just make it to third grade and be okay in the world. It's technically not, but that is where we're teaching. So it's
Yeah.
like getting those things. So then working, and I started getting into what's the AALNC, which is the American Association for Legal Nursing. And
Okay.
I've been doing that for 14 years. Took me a
Wow.
while to get to where I am right now,
Mhm.
but this is where it all of a sudden, like I said, opened up doors. And then I remember going through nursing school, and I remember this one professor I had. I don't know if you had this experience, but you're in clinical, and then when you have that aha moment, like something just clicks when you're learning it at like the book.
Mhm.
I've been studying this, I know it. And then when you see the patient, you're like, I get it now. I get it,
Yeah.
you know, and then that cycle happens. And that is what made me want to start to be a teacher. So that's when I
Yeah.
started going for my bachelor's. So I went to UMass Boston because since I was already a nurse, it was an
Yeah.
online program. And then I kept going and I got my master's. So I did it in a focus of nursing leadership with the focus in patient safety because I was working the bedside and doing
Yeah.
tele. So alarm fatigue is
Yeah.
such a big thing of like hearing all those noises around you
Yeah.
and what actually you need to actually like, we need to go run for that. Or
Yeah.
it's, silence
Yeah.
that. It's okay.
Yeah.
But that's such a hard
Exactly.
fine line because they have
Yeah.
yellow alarms, whatever colors your program has, and then red
Yeah.
alarms kind of thing. So that
Yeah.
is kind of where I kind of fell into where I am right now, kind
Yeah.
of thing. So like, what would you say is the most rewarding part of your nursing journey?
I don't know. I mean, when I look back at it, because how many times do we say, like, oh, I wish I wasn't a nurse, or because days are really hard. But when I look back, I'm like, I don't want to be anything else though. And I think about where I am now and where I started, and some of the patients that really made an impact on me along the way. And hopefully, I made an impact on them. And just knowing at the end of the day that we're doing a job that's helping people and we're making a difference makes it worth it on the hardest days.
Yes. Oh my God. So I would say, like, what do you do, like, with your nurse practitioner? Are you practicing as a nurse practitioner? Are you still
So
doing like outpatient stuff? Like, what
I'm
kind of things are you
still, I
doing?
haven't finished school yet. So I took a break right now so I could recover from surgery. So I will go back in May, I think. But
Okay.
basically, I've been working as an outpatient RN in cardiology, and it's some phone triage, some hands-on, some doing testing and diagnostics and whatnot. We do a lot of nurse visits, wound checks. But what I was finding there is, okay, this is a good in between like being, a nurse in primary care where you're literally on the phone all day and being at the hospital. But is this going to be enough for me long term? Probably not. So that's when I decided to go back to school. And the plan has been that I'd work as an NP in that cardiology practice when I'm done. And I've been super excited about that plan. I love all the providers there. They're fantastic. And it would involve, seeing patients for, I think you work kind of with certain providers, but really you can see anyone's patients. And in between seeing their primary cardiologist, they might see you, or and some of our NPs will do stress testing and whatnot for, the Lexi scans and all that. But
Hmm.
so it's a lot more than what I'd get to do or what I am doing now. So that's exciting to me that having been through the last 2 years of my life and going through IVF again and having failure after failure, and then finding out that, oh, I have stage 4 endometriosis that has been missed since I was a child. Because, as I think I told you, I actually had a surgery to check for endometriosis when I was 20. And I was told, hands down, you do not have endometriosis. And as if that wasn't bad enough, instead of saying to me, like, if the pain persists, let's explore other options. Let's look into this or that, or maybe we send you to a specialist. It was literally, well, if you can't handle your period, I'll stop you from getting one. And
Yeah.
she shut me down and she silenced me and she made me feel pathetic. And so years went by where I was suffering to the point of having pain that would nearly make me faint. Um, I did faint on a couple occasions, and I wasn't telling anyone because I was made to feel like I was crazy. So if I don't want to be labeled as crazy, I'd better keep my mouth shut. So
Yep.
I did. And then I got to IVF and I did share everything with them. I told them how painful my periods were. I mean, I literally had almost, I think I have every common symptom of endometriosis, and it was still missed for 24 years.
Oh, I'm with you.
Um,
Oh yeah. Yep.
so,
That's like me because I had this, I could say the same exact experiences.
yeah,
I guess I didn't know all of it because you get on birth control. And you're
yeah,
on birth control because you're like, I don't want to get pregnant now. You know what I mean? And you just go along with what the
yeah,
doctor tells you to do.
yeah,
Then when you get into, okay, I'm settled in life, I have my career, I'm married, and I want to start a family.
yeah.
And then you cry, as they say. And then 6 months later, you're like, nothing's
Something's not
happening,
right. Yeah.
and then you go back and then they sit there and they say, oh, it's your hormones that are off.
Mm,
Oh,
yeah.
it's this that's off.
Yeah.
Oh, it's this, and you try to
Yeah.
go through the whole process
Yeah.
until something else happens. And then, yeah, I got diagnosed when I had the surgery, where it's like I had the pain and they did an ultrasound and they're like, oh, you have a cyst. And I'm like, oh, okay, easy, easy
Yeah.
fix. Don't worry about it. And
Yeah.
that's when I had the laparoscopic, and then they went in there and like, oh, by the way, you have endometriosis. It was in your whole abdominal cavity, but don't worry, we cauterized it. You're fine now. And
Yeah.
now here I am again, a year later, with the
Yeah.
same cyst, and now it's an endometrioma, which
Yes.
is twice the size. And I
Yeah.
have to have surgery. And this time around, they're like, we're just going to take the ovary out.
Yeah.
And then we hope your right side's fine. But then when I actually, being the nurse I am, I looked at the records and I go, I have a cyst on my right side. So if you take out my left side, my right side's still messed up, even though you're like, let's hope your right side's fine. But I'm like, it's not. And she made
Yeah.
no discussion of it. She just kind of said, this is our plan. I'll see you in
Yeah.
3 months. Have a nice day. And I was like,
Yeah.
okay. And like, I get what you
Yeah.
mean with the pain
It's
and
so hard too because so what I've learned along the way is that there's so much miseducation about endometriosis, and to the point that I don't think I want to be a cardiac NP. I want to do something where I can help people in our position. Maybe not work straight in endometriosis because I'm going to help the people that already got to the specialist. So I'm not helping us per se because we struggled with no one listening to us for so long. So I
yeah,
don't know if I want to work in women's health or maybe primary care where I can spot these people that are suffering and get them to the right people. Because the thing is that all these regular gynecologists are thinking I can treat endometriosis, but they can't. They
no,
can't do it successfully or properly. Using ablation instead of excision is not the right move. Because in your case, here we are a year later and it's back. So if it was excision, it would be less likely to grow back. And if it did grow back, it would take longer. And then they have tissue to actually biopsy and say, oh, yes, this is definitely endometriosis. Um, Not to mention, unfortunately, the ablation or cauterization can actually do more damage. So, one of the things that's my goal through my career, wherever I end up, is that I can educate other providers so that women are getting the care that they need and deserve instead of basically being burned and made worse.
Right. Yeah. So you sent me an outline. I would just sit there and ask to say, what is your future envision for the course or what you're going to be offering so people have like an understanding of where we are going to go in the next 5 to 10 years.
Um, so let me pull up that outline because
Yeah.
I have honestly not been super on top of this because
It's okay. I feel like we're both in the same boat because I'm
yeah,
learning so
yeah,
much that I'm like, I'm going to start blogging about certain things, and like we are on two different sides where I'm more of like the education, like the legal part, like all that of
yeah,
helping. And that's why I created so educationalnurse.com. I created something called the New Nurse Navigator,
yeah,
where it helps the new nurse learn like the bedside stuff of like what we do and
yeah,
like where to start. And it's funny how this has kind of evolved into something so different of I realized that I've been trying to be so holistic with myself and then
mm-hmm,
realizing that I have this basics, but like what everybody else needs in the world, and especially women's health and everything else. And I've been trying to add in because part of it too is I talk about a work-life balance, how to deal with stuff. Like, yes, you go to work. So I realized it's not just the nursing that I'm trying to focus on because I we really want to help the nurses, but I
yeah,
realized it's such a bigger, broad thing of like when I actually step back and then we had this conversation of like, where do I envision this going? So a lot of it, I think, is holistic and being
yeah,
a holistic nurse because I'm actually
yeah,
going to see a holistic provider
yeah,
because I have so many different symptoms because I go,
yeah,
I have a headache, my back hurts, my neck hurts, this hurts, I have joint pain, I have abdominal
yeah,
pain, like we said, and then
yeah,
nobody is listening because
no,
they just look at us and say, you're a woman, just deal
yeah,
with that period of yours, or just deal with
exactly.
it.
We
And
can
it's
just
like
blame it all
life
on
just
that.
builds and builds and builds and builds. And one of the biggest thing I say to everybody is just like, how do you see the cup? And a lot of people look at me and they're like, what are you talking about? And I said, how do you see the cup? The cup is it's half full or is it half empty? Do you see things positive or you see things negative? And it's all how
Mhm.
your perception is
Exactly.
about life or your life in general.
Hmm.
So did you pull, were you able to pull it up?
Yeah, I have it up.
Okay.
So I think one of my biggest goals with this is for providers who are seeing patients, whether it's a nurse or a doctor or an NP, to be able to spot the signs of endometriosis earlier and to know enough that referring to regular gynecology, or if they are a gynecologist doing the surgery themselves, as much as they might want to and be well intentioned, isn't right. That, there is excision surgery is actually quite difficult and it takes a lot of specialized training. My excision surgery took 4 hours because they carefully go in and use scissors and they're cutting away layer by layer until they get it all.
Yeah.
Um, when I had my surgery when I was 20 and I was told, no, there's no endometriosis, I was in the OR for I think 20 minutes.
Mm-hmm.
So it's just, I think that's my biggest thing is that I want I want people to know what endometriosis is because some people hear that word and don't even know what it is or have a misconception of what it is. Um, I want people to be more aware of the symptoms. And one of the things that has stood out to me was a doctor at Mount Auburn said this. He actually said it in the movie Below the Belt. I haven't watched it yet, but I'm dying to.
We
Um,
should watch
said,
it and then we have a review on it.
yes, we
We should
should.
do that. Maybe we
We
can
should.
say for next week's little meeting, we can say we'll try to watch it in between so then we
Yeah.
can talk about it because there is so I feel like the only way people maybe get things is if we something visual, because I've
Yeah.
learned teaching, it's like audio, visual,
Yes.
everything else. Oh, my thing just came up.
Oh, yeah, it says time left 10 minutes.
This is where I
Um,
gotta think. It's funny how like I said, I'm learning all this stuff and
yeah.
like Google Meet, I think is longer. I'm like, I don't know. That's why I was like, did
Yeah.
you get it? Did you not get it? Because like I am happy because I feel like it's amazing how where COVID we've learned a lot of stuff is online. I had to
Yes.
learn and teach online. And then I
Yeah.
just sat there and I was just like, your assessment skills look good, but I'm not sure what you saw or heard, or blood
Yeah, it's so
pressures. And it's
hard.
like the students of today missed so much at the bedside because of COVID. And that is
Yeah.
one of the reasons why I made the new nurse navigator, because I just see so much of the fallings. And
Yeah.
I made so many like tips and tricks for newer
Mhm.
nurses, like the quick head to toe assessment. I always laugh. I'm like, 5 minutes. It's not always 5 minutes, but that's the
Yeah.
time you literally get to go into a room
Yeah.
and see a patient. So
Yeah.
like I broke it down into like a one-page thing of like, here, this is what you're going to go in so you don't miss anything.
Yeah.
Because a lot of things of today I have found is that it's like charting by exception. You're only here for your lungs. I'm only focusing on your lungs. You're only here for your
Yeah.
belly. Where I'm like, no, you missed the whole picture. And that's especially with the
Yeah.
endometriosis stuff. Like, you need to listen to the person as a whole. And that's why
Yeah.
I'm going into, like I said, more holistic nursing, because I'm complaining of so much. And
Yeah.
then I said, how can this not be one thing or connected? And
Yeah.
like I went to the neurologist and I had a meeting and I'm like, oh, when I move my eyes a certain way, I get a little lightheaded. They're like, it's just a migraine. Take your meds. And I'm like,
Yeah.
okay, but it starts in my legs and then it waves up to my
Yeah.
brain. How is something starting in my legs a brain thing? But then they
I
say
would,
neurologically it is, but how can they not all be connected? Because your
yeah.
senses in your whole body can tell
Yep.
you something different. And that's where I
Yeah.
think the misconception, like you say, of endometriosis comes
Yeah.
from, because that wave of nausea that you get that
Yeah.
can be from a migraine is actually from, you ovulating. And
Yeah.
your body has to work
Yep.
so hard just to ovulate when you don't even realize it, and it causes so much, and you're like, that's the middle, you don't even have your period, you don't even know, you're not even
Yep.
in menstruating, but like
Yeah.
that discomfort and pain that you have, it's kind of hard differencing, is this just migraine your body? Because I
Mhm.
found with the migraines, the neurologist said it goes through your thymus, which regulates your temperature in your body, and
Mhm.
that wave that you get can be a migraine, but then also it can be coming up and coming from your uterus that you don't even
Yeah.
realize.
Yeah, I would say a lot of, I mean, you've had the injury from the hospital, but I would say a lot of your symptoms could be described by endometriosis or explained by. So I'm hoping that you'll be able to see a really good surgeon like I did, because I think that's your best road to recovery. I mean,
Yes.
the symptoms that so I had endometriomas behind both ovaries. They weren't that big, but they were there. And when I would ovulate, especially on the left side, it, it would wake me from a sleep because the pain was so bad, it would like take my breath away.
Yeah. Yeah.
But Dr. Malcolm McKenzie had said in that movie that nearly all girls slash women who miss school or work because their period have endometriosis. That a painful period is actually not normal, even though we've been taught that our whole lives, essentially. That, maybe it's not the most comfortable thing in the world, but it's not supposed to hurt us. And I mean, I miss school. I've missed work. Sometimes
Yeah.
it was because the bleeding was so severe, I didn't feel like I could leave my house. But sometimes it was the pain was so bad I was vomiting.
Yeah.
So,
Oh, yeah. Yeah. Oh, yeah.
it's like
Yep. And
it's
and the
hard
thing
to
that
know
gets
no
you,
one
it
listens.
comes out of nowhere.
Yeah.
That's the hardest part. I'd be sitting, I'd be happy, I have
Yep.
lunch in front of me or whatever, it comes, you're at a restaurant, and then when you look at it, you're like, I feel so sick right now.
Yep.
And you can, I never had the experience of being pregnant. Like that is where I am moving on from, because
Mhm.
it's, I I had my tubes taken out, when I had the cyst removed, because I had an IUD in, because my doctor, I have cardiac problems, I have all this stuff, and you can't take birth control. But I
Hmm.
go, I need something or whatever. So we put in an IUD, and I feel like that was the start of all of it. Like it harmed me more than helped me, I guess, to say, because
Yeah.
it's like I didn't want to get pregnant, but I also did it because I needed help with the symptoms. So then it's like every time I would feel it and have cramps, it would hurt even more, like
Yeah.
literally pain. And so I went in for the surgery to have it removed. And I said, take my tubes out, because it's like I'm not gonna get pregnant. Like I don't plan on it, because it's just a long road. And I went through a divorce. So I don't have a partner. I
Hmm.
give women so much courage, or props, to be able to do it by yourself, to say, I have a choice and I'm going to make a baby, kind of thing.
Hmm.
But today's society, it's so
Just
hard,
doesn't
and
really
that's such a
support that.
personal
Yeah.
choice. And my
Hmm.
personal choice was, I'll be a dog mom.
Yeah.
I'm like, I'm okay with being a dog mom. But I
Yeah.
just realized that, like, when we started talking, and amazed of, like, we've been friends for how many years
I
now? Like,
know.
amazing. And then coming back around, and then you learn more personal stuff about someone. You're like, I never knew.
Yeah. We were basically going through this at the same time and had no idea.
Yeah. So it's
Because I think
amazing
I
of,
remember when you got married, and I think it was like a year or a couple months before me, because I remember meeting you and you were getting ready to get married, and then I think you were going on your honeymoon later, and then I got engaged, and so it really is. We were going through it all at the same
at the
time, and
same
we had
time,
no idea.
and had no idea. And it's amazing. So, like, I guess the goal of all this is like how, because I just want to be able to share, like, our experiences, especially
Yeah.
being a nurse, of what there is out there for one, a career for nurses. Because one of
Hmm.
the reasons why I'm doing this, that I'm learning, is this, like, it's not just about being at the bedside, because I had such a hard time. I did it and worked at the hospital for 10 years.
Hmm.
And I go, I don't, I love this. I love this feeling that I get when someone is so sick, and then they walk out the door, and you're like, I had a
Yeah.
part in that. And
Yeah.
that just makes me so happy. But then on the other side of, like, we are so physically abusing ourselves, mentally, all of it, that it's like,
Hmm.
I need to do something forever, because as we said, there are unicorns out there who do this forever. It's like I give them so much props, but I realize that, like, my mental health and everything, I can. So
Yeah.
going into a different career path is what I want to help bring into awareness of nurses,
Yeah.
because we can have a W-2. Like, I work as a W-2 worker, so then you get your benefits and all that. That's the beautiful thing about a hospital. You only have to work 24 hours and you get benefits,
Yeah.
you have all the other times to do what you want. And that's why I always say you should be trying to make the most money that you can, working per diem somewhere else, or
Mhm.
exploring other options as a nurse. Like
Yeah.
you say, working in the outpatient, it's so night and day, and it
Yeah.
balances out your week and your time. So it gives you time to recover, to be able
Yeah.
to say, I'm ready to go back to the
Yeah.
bedside,
Yeah.
kind of thing. I don't know
There's
if we're
so
going to
many
have to,
options.
like, stop recording and then go back in, because it only has a minute left.
Yeah.
Because I said, I go, I'm trying to figure all this stuff out.
I
Oh
know
my
it's
God.
challenging. But yeah,
Everything's
I mean,
changed.
there's so many options in nursing, and one of the things I think I miss the most about the hospital is I always precepted a student nurse, and I really love that because I love to one-on-one help that nurse to grow and learn more. And I've stayed in touch with, I think, all of the nurses I precepted, and um, but now I want to just take it a step further. And once I am a provider, I want to be able to be a support to other providers, regardless of whether they're an advanced practitioner or an MD, um, so that they can know more about this, so that we're not sitting with other women who are repeating the cycle that we've already done.
Right.
So,
Right.
no,
I know it's less than a minute. I'm like, I guess
I know it's
do
not
we do
counting
another
down.
one? Because I'm gonna have, like,